But why is this? It's real simple. Two diseases are pushing people toward dialysis, chronic kidney failure. And it's number one, diabetes, and number two, hypertension.
Hey, Kyle Colbert here, and if you don't know this number, chances are you may need a transplant to survive. This number is critical. Over 14% of the population has this number, and in some races and ethnicities, it's as much as 20%. My name's Kyle Colbert. This is Dr. Colbert's broadcast. We are excited. I'm here with my dad, Dr. Don Colbert, my mom, Mary, and we are talking about number 9.
Number 9 is know your kidney numbers, and this is your key filter. You see, when your kidneys start to fail, you usually will see a nephrologist, a kidney specialist, and I've had many people I've sent to nephrologists over the last 40 years, and what they come back to me and says, Dr. Colbert, they just checked my blood, and they're just waiting for me to have dialysis. And that's no way to live, because most people, when they start dialysis, they only have 1 or 2 years left, or they have to get a kidney transplant. So you got to know your kidney filters. African Americans, approximately 20% of them are developing chronic kidney failure. 20%, 1 out of 5.
Yeah.
Hispanic Americans, about 14% will go on to develop chronic kidney failure, and about 12% of the white Caucasian Americans. But why is this? It's real simple. Two diseases are pushing people toward dialysis, chronic kidney failure. And it's number one, diabetes, and number two, hypertension. And so these are the drivers. The high blood pressure. And if you have both high blood pressure and diabetes, it is a double whammy on your kidneys. You are slowly damaging and destroying your kidneys. And we want to protect them. We got to protect them. I had a patient that came to see me at 60 years old, and he was on dialysis. And he said, I want to follow your nutritional program. I said, but you're on dialysis. And he says, but I'm on the list to get my kidney transplant. And once I get my kidney transplant, I'm doing everything you tell me so that I can live a normal life. And so again, don't wait until you need a kidney transplant, because it's really sad. He may not get his kidney transplant. But again, here's your numbers. Men, your creatinine, we check your creatinine, your BUN, but especially the creatinine. That's your most important kidney function. It needs to be 0.7 to 1.3. It's got to be less than 1.3. For women, it's 0.6 to 1.1. If it's over 1.1, you're in trouble. We got to know our numbers, and we got to lower these numbers. The key ways to lower these numbers is to lower your sugar and lower your blood pressure. You see, when you have high blood pressure, that blood pressure, if it's up over, now the high number is 130 over 180. It used to be 140 over 90, but in 2017, they lowered the normal range from 140 over 90 to 130 over 80. So know your numbers. You realize that only about 21% of people with high blood pressure on medications have it controlled. The vast majority, their blood pressure is not controlled.
What percent?
21%, only 21%. So that's pitiful, pitiful. 21. That's a grade. If you're making 21%, you failed. Okay. And so again, we've got to know these numbers, and we've got to lower it. So in order to correct your kidneys, you need to know your blood pressure throughout the day, and you got to lower it.
What time of day?
Now the blood pressure is usually highest in the morning. You see, we have a circadian rhythm where in the morning, our cortisol is usually highest, and cortisol raises our blood pressure, but it wakes us up. So our cortisol level is usually highest around 8 in the morning.
Wow.
And that's why most heart attacks occur in the morning, usually Monday morning.
Wow.
This morning.
Oh, no.
So again, so cortisol levels, when it's high, the blood pressure spikes. But also when you drink coffee, the more coffee you drink, the more cortisol and the higher your blood pressure goes. From like 4 or 5 millimeters of mercury up to about 15 millimeters of mercury.
Well, I'm not going to refill my
For 2
coffee.
to 3 hours, okay? So again, we've got to get our blood pressure down. We need to know our numbers. And how do you lower your blood pressure? And how do you lower your blood sugar? Well, first of all, for blood pressure, there are many good blood pressure meds. Get on the meds that lower your pressure to normal. That's really important.
So you
That-
do support meds.
Yes, I do.
Oh,
There's some
critical.
really good meds.
I know he does, but
There's
some-
ACE inhibitors, there's ARBs or angiotensin receptor blockers, there's beta blockers, there's calcium channel blockers, there's diuretics. You got to get on a program and monitor it and get your pressure down to normal. Or else it's just like someone hitting your kidneys every time that pressure is high, and it's damaging those nephrons and destroying nephrons.
Now, what's good to know, and I think this is important for you to hear, that even if you're on medicine, because a lot of people think, I hate medicine, I don't want to do medicine, I want to do it natural. On a short term, you may need to do
Yes,
medicine.
that's true.
And that is critical. Don't be ignorant about this. Go ahead and get on the meds, get your blood pressure down. And then what is so beautiful is that there are things you're going to be able to do, and he's going to tell you that you can slowly
Right.
begin to come back off
Exactly
those
right.
meds.
We've helped so many people.
I
We
can't-
put them on meds, but then we wean them off.
Hundreds and hundreds of people we
But
help.
first, we need to know what raises the blood pressure. So this raises the blood pressure in everyone. We need to know what raises it. Belly fat. The more belly fat you have, the higher the blood pressure generally goes. So belly fat will raise your blood pressure. Salt. The more salt you consume, generally the higher your blood pressure is. And if you eat out a lot, that's the main seasoning of food is sodium or salt. You want to bring your salt level down to 1.5 grams a day or less. That is key.
and there has been a trend lately on consuming more salt.
I know, exactly.
And so there is all these social media guys that are going, you need, more salt, more sodium in your diet.
Some of that is
They can
from
raise,
some of that is coming from there's so much exercise and
yeah,
people
and if they're
are,
exercising a lot, they may need,
exercise
Yeah,
they
it's 'cause
may
they're
need
like,
it.
or they have those.
Exactly, and that's where that's kind of
That's-
coming from.
Yeah,
but it can be confusing for people
Sure.
going, what do I do?
and then you have people that are not exercising with big bellies that are drinking coffee and eating salt, and their pressure's going up.
Through
So
the roof.
look at it like this. It's kind of like picture a garden hose. There's two main ways we increase the pressure in that garden hose. The garden hose is like your arteries. You can turn up the volume of the hose, the water going through the hose. That's like when you eat more salt. When you eat more salt, it pulls more water into the vascular system, into the blood vessels. So it raises your pressure. Also, you can put a nozzle on the end of the hose and constrict it. And that's what happens when you're stressed. It constricts the hose, or that's what happens when you're really extremely traumatized. When you get traumatized or angry, you constrict it. And that's why a lot of patients over the years, they've been really angry and exploded in rage, and they've had a heart attack because it shoots the pressure up too high.
Waiting in line, driving in
Yeah,
traffic,
exactly.
getting bad news over the phone.
Exactly, but also coffee. Coffee works like stress or anger. It constricts the arteries, and it'll raise the pressure anywhere from 4 millimeters mercury up to 15 millimeters systolic or diastolic. So, and it can last for 2 to 3 hours. So those people that are constantly drinking coffee all day long, their pressure's usually higher. And that's why when they come to my office, I'll have them check it. But then at the end, an hour or two later, we'll check it again. And usually our pressure's down to normal. I said, oh, the caffeine's out of your system. Good. Now you need to limit your coffee to just 2 cups a day. Or we need to get something that's going to help to dampen the effects of the caffeine.
Yeah, we did a whole program on know your blood pressure,
Yes.
and so your number.
Right.
And so if
So
you
these
didn't
are
see
just
that, you
amazing.
want to go back and watch
Right.
that program because we even tell you how to get your blood pressure done and the correct way. There's a correct way and an incorrect way. So be sure and watch that program to know about your blood pressure numbers.
Right, and diabetes. Watch my podcast on diabetes. Watch my podcast, especially on high blood pressure. But something that definitely stresses the kidneys, and so many people take these, are NSAIDs. That's aspirin, that's Advil, it's ibuprofen, it's Aleve, it's all of these over-the-counter meds, or Mobic, and all these Celebrex. All of these medications literally decrease blood flow to the kidneys. They decrease prostaglandins. Prostaglandins is what dilates the blood vessels and brings oxygen to the kidneys. So when people take in a lot of NSAIDs, it literally predisposes them to kidney problems. And so those patients I'll watch extremely close, and I try and get them on natural alternatives like Boswellia, AKBA, and Curcumin. It's like a natural NSAID, and it doesn't stress your kidneys. Or our collagen, And our collagen, which is chicken collagen, so it actually contains glucosamine chondroitin, 2 scoops a day. That actually doesn't stress the kidneys, yet it supports the joints and protects the joints so that they can be many times restored if they do that, along with, especially with the curcumin and the Boswellia. And then cycling. You know, there's one exercise that really helps the knees, and that's cycling. And also pool exercises, non-repetitive motion. You don't want to do running or jogging because it's stressing your knees and your hips and your back. So low impact aerobics or elliptical machine, recumbent bike, pool exercises are real joint friendly, because when you are doing these exercises, it actually milks synovial fluid into those joints, bathes those joints with a lubricant, synovial fluid, which helps the joints tremendously.
Oh, wow.
So most
What
people
about
don't
those
realize.
little mini trampolines?
Those are great for lymphatics, but can be hard on your joints. So caution with those. You'll get similar effects with elliptical machine. Elliptical machine's great. Recumbent bike. So do it
Elliptical is
easy,
gentle
easy on your joints.
joints, and you're moving, and that's
Okay.
what I do.
Right. Now, we talked about NSAIDs because NSAIDs are really stressful on the kidneys. Other meds that are stressful on the kidneys are antibiotics. And doctors love to prescribe antibiotics. Antibiotics are one of the worst things for your gut. And in my book, The Gut Zone, The Healthy Gut Zone, we talk a lot about antibiotics creating leaky gut, problems like that. But the antibiotics that really stress the kidneys are your aminoglycosides, which include gentamicin, amikacin, neomycin, and the gentamicin. And these literally stress the kidneys, so you want to try and avoid those when you see your
Now, what
doctor.
prescriptions contain those?
Well, many times when they go see their doctor, if they're in the hospital, they'll use those meds.
Okay.
And you
And
have to
Yeah.
if you're got a chronic.
but also they're using these meds for SIBO, neomycin.
Oh,
So you got to be careful. SIBO, they're given rifaximin and neomycin. So if you take neomycin too long, it can stress your kidneys.
and I know you've always said Z-Pak because that's popular. A lot of
Yeah,
people do
yeah,
Z-Pak
yeah.
out
Now,
there.
Z-Pak's not so bad. It
Yep.
doesn't really stress the kidneys like
Okay.
the others. But now there is one that's commonly used for UTIs in women. It's called Bactrim or Septra, sulfa drugs. Sulfa drugs can cause crystals in the urine. And so these crystals can lead to kidney problems if you don't drink enough water. So it's critically important, if you're on a sulfa drug, drink a lot of water to flush it out, or it can cause crystals and actually harm your kidney.
Now, what about kidney stones? Are kidney stones indicative of kidney issues?
Well, it could be, but kidney stones are usually, most common kidney stones, calcium oxalate. And so a lot of people are calcium oxalate formers because they drink a lot of tea. Tea is high in oxalate, and they eat a lot of cheese or ice cream or dairy. When you combine oxalic acid, which is in spinach, green tea, black tea, along with calcium, a lot of people are calcium oxalate stone formers. And so when we check their urine, and that's one of the keys we do we check the urinalysis, and we see if there's calcium oxalate crystals. If so, there's a simple supplement that removes calcium oxalate crystals called Kidney Cop. You can get over the counter. So that helps. But also there's uric acid stones. That's why on every patient I see, I check the uric acid levels. Uric acid stones are the most painful stones. It's like a kookaburra with thorns on the end that just hurts like crazy. But these are people who have gout. They get gout usually in their big toe or their elbows. They get tophi. This pain so painful in the big toe that it hurts to lay a sheet on top of it. And so that's why I check uric acid to identify those. Those are your two main stone formers. There's mainly calcium stones or uric acid stone. There's calcium oxalate, calcium phosphate stones. So those are the key things.
Tell us, what can we do to actually improve our kidney score? Our kidney.
I will, but I've got to talk about two other meds that are hurting your kidneys.
Okay.
Zolvirex. Remember the herpes simplex one?
Of course.
People are taking Zolvirex, but also if they have shingles, they take real high doses of Zolvirex, 800 milligrams 4 or 5 times a day. If you take high dose Zolvirex or you take IV Zolvirex, you're more prone to form crystals in your urine and kidney problems. So just be careful with Zolvirex and make sure you drink plenty of fluids, and they're monitoring your kidney functions if you're on high dose
And when you
Zolvirex.
say fluids, you're saying water.
Water. And then the last one that so many people are taking or proton pump inhibitors.
Mm.
So many people have acid reflux, so they're taking the Nexium, the little purple pill, the Prilosec, all these different ones, and that can stress the kidneys. So people on these meds need to monitor their kidneys and monitor their urine to make sure that they're not stressing their kidneys, and drink plenty of water. The last is contrast dyes, CT scan dyes. They use contrast material that can stress your kidneys. So after that, you need to make sure you drink a lot of water to flush the contrast out of your kidneys. And so if you do that, it'll protect you. Now,
Yes, for women who've had breast cancer or you have tumors, they do that contrast dye
yes,
in
you
order
gotta
to pick
flush it
out
out.
additional potential tumors. So that's an important.
Now we want to talk about what helps the kidneys now.
That's what I want to
Well,
know.
the biggest thing is glutathione.
Ooh, okay.
Glutathione is so protective for the kidneys. And here's the glutathione helps protect the kidneys from damage caused by reactive oxygen species. See, the body creates a lot of inflammation on its own in reactive oxygen species, just in the presence of oxygen. It creates superoxide dismutase and reactive oxygen species that damage the kidneys. But the glutathione quenches that. And so I recommend just glutathione, just 4 to 7 sprays a day. If you're getting kidney issues, go up a little higher to 7 sprays twice a day.
Now, what's interesting is glutathione's a large molecule. We know this because
Right.
we have a lot of history in glutathione.
Right, sure.
You have especially a lot of history, but it's a large molecule and it's tough for your body to absorb. And so that's
We
why
nanoniced it, right?
you make it a nanoparticle, really small and easy to absorb. And so that's the unique aspect of this nano glutathione.
And we have a spray and a dropper, which is good. Now, the other supplement that supports healthy kidneys.
What foods help boost glutathione? Because glutathione, I know it's the master antioxidant,
Right.
master detoxifier.
Right, your cruciferous veggies, your N-acetylcysteine, which is an amino acid, and like your undenatured whey protein. We used to have an undenatured
You
whey
used to-
protein.
do you remember?
I used to use that.
I used to drink like the gross. Oh, I think
we don't have
that over.
But you can't get near the levels of glutathione that we can get from the nanoglutathione. So it's a superior delivery.
You also can boost it through getting in cold water.
Oh, yeah, cold plunges are great.
Cold
Absolutely.
plunges are great.
Coffee enemas are great. Who wants to do that?
Yeah, I know. You know,
Most people, you can't pay them to do a coffee enema or a cold plunge.
I'll pass.
The boss says, come over to the house, we'll do a coffee enema and a cold one.
Sick you.
But I'm hearing they are pulling back on the cold plunge now. That there is some
We're getting
contradiction.
way off tangent.
Yeah.
Let's talk about
There's-
what
they're
corrects
pulling
the
back on
kidneys. NAD. This stuff is my new favorite supplement.
NAD.
And I do this twice a day. Now, I take 2 scoops in the morning, 2 scoops at noon, because listen to what NAD does. The research is amazing. It shows promise in protecting against kidney damage and may improve kidney function, especially in diabetic kidney disease and acute kidney injury. NAD can improve mitochondrial function, which is vital for kidney cell health. It's been shown to prevent albuminuria. It reduces kidney energy markers and improves kidney functions in diabetic mice. It's my new favorite supplement because not only does it help mitochondria in your kidneys, but in your brain, in your heart, in your muscles, all over your body. This stuff is fuel for the
There's a
mitochondria.
famous podcaster. I won't mention his name, but he brought in a doctor and he said that his beard went from gray to dark after doing
That's funny.
So, yeah, NAD is powerful. When I take it, I notice my brain is activated.
Oh, it just
And
fuels the brain.
When I
Love
play
it.
pickleball, I have to have this.
This stuff
I'm a
is
different
great.
player.
It is.
I mean,
You're
That
having
and our
edge.
pickle powder
Well,
together.
Also,
That's what I do.
Also, berberine and our carb assist that contain berberine. Berberine helps to support the kidneys. It has renoprotective effects against various kidney conditions, including diabetic nephropathy and renal fibrosis. And last but not least is the oleocanthol or the high-phenolic olive oil. This stuff is amazing,
What
Carl. The
about our
research is incredible.
cortisone?
As Sertrazone is also very good because it lowers blood pressure.
Right.
And it has tremendous antioxidants.
they
great
support
for
healthy blood pressure.
supports healthy blood pressure, correct. But oleocanthol is in this high-phenol olive oil. It improves renal function biomarkers. It reduces inflammation. It reduces oxidative stress to the kidneys. It improves renal damage and endothelial function, improves blood flow. It has strong antioxidant properties. and it's a major factor, as the oxidative stress is a major factor in kidney disease. And this is, excuse me, a whole new classification of olive oils. Choose olive oil in your salad. I do it every day. I do it 2 or 3 times a day. Use the high-phenolic olive oil with lots of oleocanthol.
Wow, a lot of information, really good information. If you're interested in any of these nutritional products, NAD, the Carb Assist, the Nanoglutathione, you can go to divinehealth.com or go to target.com, amazon.com, and walmart.com. We are now going on to number 10.
Yes. Are we
Right.
at Walmart?
We are
Where?
walmart.com.
Okay.
We're on number 10. So number 9, make sure you're between 1.6 and 3 on
Yeah.
your kidneys. Okay, that's your number.
0.6 and 1.1 for women, 0.7 and 1.3 for men. That's your range, guys.
Okay.
If you're over that range, get on some of these supplements and get it to normal. Get your blood pressure down to normal. Get your blood sugar down to normal, and monitor them.
Our next shows will be on the last numbers you need to know.
Yes, we're not going to tell you yet because you're going to have to stay connected to us. We'll see you next time. God bless. Bye-bye.